I'm Al McFarlane. Welcome to The Conversation with Al McFarlane. I'm glad to be here. I'm glad to have you along as well. Today is Friday, 7/28, July 28th, 2023, and a beautiful cooled off day here in Minnesota. I hope people are finding relief from the climate change motivated, activated weather catastrophes happening both around the country and around the world. What does it mean? I think it means we have to pay attention to arm ourselves with information and weigh in on policies that affect the health of the organism planet Earth. We've got a voice. We have to inform our voices, our minds, our neighborhoods, our families, and we have to speak up and show up and advocate for policies that keep the world in balance, that are not uh, extractive and exploitative, and that are not damaging, and that don't lead to the crisis we're embarking upon now. We're continuing this down the path of global warming. Well, let me begin by, as always, inviting you to support this program the way you have and the way you continue to do by subscribing and liking and sharing. We're presenting to you across several digital platforms. We're glad for the technology. We are pioneering as a community newspaper, news organization, in using a variety of modalities to engage our readers, not only locally in the neighborhood where we live and where we launched Inside News, but due to this technology, thanks to this technology, we now see the whole world as our neighborhood, not just 20 blocks this way and 20 blocks that way, but you look east till you come around to where you are again and look west the same way. The planet, the world, because of digital technology, makes us able to call the entire planet our neighborhood. We want to act like that. And we want you to be part of that global community. And you do that for this program, The Conversation with Al McFarlane, by going to YouTube, Inside News MN, that's our channel, and hitting the subscribe button, be a subscriber, and then like and share. When you subscribe, you simply get notifications when the show is going live. And our goal is to get 1,000 subscribers. We're at about 500 now. We're getting there. So we want to accelerate and we want to go beyond that. The other thing is that, just so you know, we're streaming across two YouTube channels. So the one is the Inside News channel, but we're also streaming across the channel for the Black Press of America, YouTube Black Press USA. Wonderful and powerful relationship with the National Newspaper Publishers Association, and over 200 newspapers that speak to 30 million people every week. We're part of that flow of information, and we're pleased to. We're bringing that to the digital arena as well. Now, we also stream on Facebook for Black Press USA, Facebook for Inside News, my personal Facebook page. We're also streaming to LinkedIn and to Twitter. So any way we can, we want to connect with you, and we want you to help us, show us that we're connecting by dropping a note in the comment section, say hello, shout out your community, your people, and shout out your ideas, things you want us to talk about, things you want to bring to the conversation. Well, I wanted to, before I go any further, reach out and say thanks to our friends over at the Minnesota Department of Health, because they are reminding you and reminding us that the risk for COVID still exists. We're partnering with them to remind you and the community that the risk still exists, and that we should continue to follow COVID-19 protocols, meaning wash hands, stay aware, prioritize prevention, and together we can create awareness, encourage testing, and help everyone stay healthy. So enjoy the show, and remember, get well and stay healthy as well. Well, yesterday's program was awesome. I had a chance to connect with colleagues, two of my colleagues, in a bicontinental fashion, and one colleague who's here in Twin Cities. A great conversation. Youssef Mjini, Ndugu Youssef Mjini, who's a master communicator here in St. Paul, and an educator and journalist and radio producer. joins me regularly on the Thursday edition of The Conversation with Al McFarlane. And this time we had two other of our contributing colleagues, partners, one from Bahia in Brazil. You've seen him often, and that's Mestre Yoji Senna. And he gives us commentary about how it looks to be Pan-Africanist African in the country, in this hemisphere, the largest population of African people. You know, here's an aside. We often think that because of the way we are raised and the way we consume information, that we are the center, and that, the slave trade brought us here and we are the sole victims and the center of that. But that's simply not true. We are a small portion of it. Many, many, many more Africans were stolen from Africa and deposited in South America and in the Caribbean. And in fact, Brazil is the largest population of Africans outside of Africa anywhere in the world. So we have the fortune of having that relationship with Yoji Senna, who's an editor of our project that we call Afrodescendientes. And yesterday we talked with the person that helped motivated the relaunch of this project, Afrodescendientes, was Jesus Chucho Garcia. He is a political activist, a former ambassador. He lives in Caracas, Venezuela, but he travels throughout South and Central America as an educator, as a speaker, as an organizer, as a book writer. And his theme is African cultural unity, the reemergence of African civilization. His theme is Pan-Africanism, how we as African people get to and can and must know each other, and in doing so, become our best and our truest selves. He is also a person that writes regularly, so you'll be seeing his columns in the paper again on a regular basis. And the beauty of it is that we're trying to do something special. We're innovating by presenting stories that he'll write and others write in the section of Inside News that we call, I mentioned this earlier, Afrodescendientes. Well, this current Monday's edition features a cover story that demonstrates how this concept of Afrodescendientes works. So here's the cover, and it's a story written by our education and culture editor, Dr. Irma McLaurin. It's on the life of James Haskins. And Jim Haskins, she writes, is a person that nobody really knows about, but he's a humanitarian philosopher. He's really the unofficial biographer, she says, of Black America. He's edited or written over 164 books. And so she raises a question, why don't we all know? Why isn't this part of the present awareness of all of us in the country, particularly those of us who are the descendants of the African slave trade? So what we did with this story is presented the lead story on the front page in English, and then we translated the same story into 6 different languages. Inside the story, we ran it in Swahili, we ran the story in Somali, we ran the same story in Spanish and Portuguese and Yoruba. So what's the point, Al? We're trying to demonstrate that we are showing up in a variety of languages around the planet, but also in each community. There are Yoruba speakers here in Minnesota. There's a huge, huge Somali population here. There are Afro-Latinos here. So people, question that. There's the image of Latinos being, Mexican, or Mexicans being, white and native mixed. But if you haven't been, and if you do go to Mexico, what you're going to discover is a lot of people that look just like me and just like you, and people who identify themselves as Latino, but they are Afro-Latino, Afro-Cubans, Afro-Peruanos, Afro-Uruguayans. But there are large African communities throughout the Spanish-speaking world here in the Western Hemisphere. Our job, I think, is to reflect that reality and to encourage us to not see Spanish-speaking Africans or Yoruba-speaking Africans or Portuguese-speaking Africans or Swahili or Somali-speaking Africans as them. Our job is to have us all see us as us, showing up in all of our authenticity and masters of our own story, telling our own story and telling it with the flair and the joy and the genius that we bring to everything that we do. So, check it out. Check out Insight News, the newspaper, Monday's edition. Will have these stories in a variety of languages. And then from this point on, you'll see the section in the paper. The section will be called Afro Descendientes, Descendants of Africa. And check us out online as always. And enjoy. So, if you have any suggestions or comments or feedback on that, love to make that happen. I see I got a note from in the chat from Maestre Sena, who's in Bahia, and great for the note, brother Yoji Sena. Well, let me go ahead and get into today's program as we always do. Today, Friday, is the Healing Circle, and we begin this program with a special protocol that invites us to center on what it is to be Africans, the African way, an Africana way of knowing, an Africana way of being. And I love this beginning, this formula, this format for launching the program, because we invite our dear sister and leader, Dr. Bravada Garrett-Akinsanya, to explain, what the circle is and what the talking circle is and how we create a protocol. Why is this important? So when I visited Ghana a few years ago, the first time, like it must have been 94, 95, I was in a series of meetings, and every meeting started with a certain formula. I didn't know that going into it, but I watched it meeting after meeting after meeting. What was happening? Well, the meeting would be called to order, and whoever was convening the meeting acknowledged the elders and political leaders in the room, but before that, acknowledged the creator and the ancestors, and asked that their presence, the creator's presence and the ancestors' presence, guide his or her or our conversation, our being together, and that what we said was consistent with the history, the legacy of our people, and also consistent with the expectations that those who are yet unborn have of us, our commitment. So let me stop right there and go to and bring in my dear sister, Dr. B, as we lovingly call her, Dr. Garrett-Akinsanya. Dr. B, how you doing?
I'm fine. Thank you so much. It's wonderful to be here again with you on the Healing Circle. And this Friday is such a special one when we talk about COVID and its impact, disproportionately negative impact on our communities. And to come together in circle as healers of communities is one of the most precious gifts that we can give ourselves and each other. So I'd like to share, as our listeners join us today, that this sacred circle is one from which we have permission from our elder. And I see Baba Al giving me permission to speak. And in that context, we also acknowledge that in the circle, there's a sharing of power. There is no beginning, there is no end. And everyone in the circle has equal access to the center, which is the space of power where we give voice. And as we honor our elders, we honor them because they're the shoulders we stand on. We honor them because they're closest to our ancestors. And we honor our ancestors because they're closest to the Creator. And as we honor each layer of our being, we recognize that our connection, the idea of consubstantiation, that all living things are connected, and we're connected to the earth and the sky and everything in it and to each other. As we sit with that acknowledgement and engage in this conversation, we do it in an orderly manner. So unique to us is, although if we were in a circle, we would have a talking stick, we use a virtual talking stick. And we ask for the stick if we have something to add, or it will pass and flow from one member of the group to the other. So, with that, we say welcome to the Healing Circle, and especially to today's program where we look at the disproportionate impact of COVID and long COVID on the lives of African Americans. And the idea is it's us, it's still us, it's us again. And why is it us again? Why are we always the ones that are on the end of having to do the greatest healing and the greatest sacrifice? So with that, I pass the talking stick back to my Baba Al.
Well, thank you. I'll take the talking stick and let me turn and pass the talking stick to our friend and colleague, Dr. Oliver Williams. Dr. Williams, always such a pleasure to hear you, to be with you, to listen to you. Your analyses and your voice just generate healing. You epitomize the spirit of healing in what you say and how you say it. And so I'm going to pass the talking stick to you to, in any way that you'd like to, set our conversation forward on how the pandemic has exacerbated the issue of domestic violence in the African American community.
Thank you, Brother Al. And good to see you, Dr. B. How you doing? So, well, we're trying to get my friend and colleague, Dr. Phyllis Sharp, into the show. So Jasmine is, working on that. But I talked to Phyllis, and Phyllis is a emeritus professor from Johns Hopkins University. And she was associate dean for a project and an endowed chair there. And so Phyllis and I have been friends for a long time. And she works with Dr. Jackie Campbell, who's a noted nurse as well. And both are in the International Nurses Hall of Fame. And so when we get Phyllis in, we will get a chance to talk more, and she'll be able to discuss with you some of her insights associated with COVID, African Americans, and domestic violence. That's one of her areas of emphasis as well as Jackie's. So the way that I understand it is that the COVID certainly affected everybody, but like Dr. B said, no more difficulty than the African American community. And one of the issues that we face associated with that is the fact that when one deals with the issue of COVID, and when we were dealing with that challenge, one of the issues was there was no place that anybody could go. People had to stay in their homes because shelter programs weren't prepared to be able to deal with the challenges associated with COVID, and the fact that there are other people, many people who were dealing with the challenges associated with that. And so people basically had to stay in their homes. So, and there was no place else to go. And so as an issue associated with that, we were dealing with the challenges associated with, not having supportive places that one could go to. So if you had family members, one of the challenges is, the fact that you might not have been able to go to a family member to find support. If you had somebody else that you could go to associated with that. So, and then when people get angry, if they're closed environments, for individuals dealing with domestic violence and that there was no place else that you could go to. You had to suffer in the environment that you were in. So that's one for people who are dealing with the challenges of domestic violence. That's part of it. The other thing was the fact that for some people, if they were connected with a batter's program, some programs did it virtually. So for working with men who batter, they would do it over the internet, have groups over the internet. But one of the things that I found is that for men who batter, there are some men that you can listen to and maybe accept the fact that if they tell you that they're not doing violence, that you can accept that. But for most people, men who batter, you can't believe it if they say it. You have to have validation about the issue. When I talked to my colleague uh, Dominic Waltower, and he talks about his satiation and ending his violence towards his partner. That wasn't something that happened overnight, and it wasn't something that happened just because he said so. That was something that happened over years. And the other thing was the fact that when I had a chance to talk uh, to Dominique, I had a chance to also talk to his uh, ex-wife. He and his ex-wife. If you go to Will, that's WILL, the number 2 TO, the digit change.org. Both Dominique and Mary can talk to you about their path to uh, the end of his violence. The thing, and you can listen to both of them. The thing that's interesting to me about listening to their stories, and you can go to it says a former couple talks about ending their uh, violence. You'll hear Mary talk about her change and transformation associated with her exposure to his violence. And you'll hear Dominique be brutally honest with you about his history, but his change and his acknowledgement associated with violence, but his change associated with it too. And it wasn't something that happened overnight, and it wasn't something just because he said it that you believe it. You have to get validation from other people. So, we're doing a conference in late August, and we'll have him and his adult children talk about his violence, but also talk about his change and transformation from violence. Now that he can talk about his children. He says some very interesting things associated with it. For example, his children had to give him a Yelp review. And so one of the things that he says is the fact that his children, now they're adults, 31, 26, and 21. They said that he and his ex-wife sucked his parents because they knew that violence was going to happen, did happen. And then, but his wife was a safe place and his mother-in-law was a safe place. And one of the things that he had to do was to learn how to be a safe place. Then his children would come to him.
Very good.
So with that, I'm going to turn it back to Dr. B, and we'll get a chance to, talk a bit more about COVID and domestic violence.
I want to thank you for the talking stick. I receive it gladly. One of the things that I'm thinking about in terms of COVID is the impact physiologically as well as psychologically on people who experienced it. And during the early stages of COVID, if you got it, it was as if people who were talking early stages of HIV and AIDS, it felt like it was just a pronouncement of death. So it increased a lot of anxiety, and people wouldn't check because they didn't want to know the truth. They didn't know if they had it or not. And so those who had mild symptoms or even difficult symptoms still to this day may be experiencing kind of leftover remnants of experiencing COVID. And when we talk about COVID, that residual impact of problems with lungs, multiple places around the body where people feel like they may have fibromyalgia, memory fog, where they can't remember things easily. It has multiple difficulties that resulted, that some people retained the symptoms of COVID, although they got over the disease, quote unquote. The impact that it had on their lungs and their vision about who they were and what they're capable of was impacted. Now, take that knowledge and intersect that with a hostile, violent, reactive environment, a traumatized environment where people are hyper vigilant, waiting for the other shoe to drop, where they're in a space of just being angry or irritated or easily upset, volatile. And let's say someone who has long COVID continues to say, I don't have energy to have sex with you. I don't have energy to be cooking. I don't have energy hardly to go to work. And what that may relate to in a typically or difficult experience where people are experiencing violence. So when we have those kind of relationships that kind of can explode any moment and go through that stage that we know of. First, there's the building up to the anxiety. Then it's a pivotal time where there's an explosion in relationship violence. Then after that, it goes down to the honeymoon stage and we'll never do it again. We should never have done that. And then the cycle repeats itself. When we see this, we see that people become very nervous in relationships, unreliable, and they can become argumentative. And just think about the time when, or even today, if you get COVID, then you're going to still be in lockdown. You're still going to be quarantined. You're still going to have to stay at home. And if you're in that space, you can't escape, and you may not even be safe, safe even resting, because someone may blame you being lazy or something like that. So that's why I think talking about COVID and long COVID and its impact on domestic violence continues to this day. And sadly, disproportionately, it impacts us as Black folks. And so when we get interactions, when we have violence with police, it can mean death for us. So I think that's one thing we also have to talk about. And with that, I'll go ahead and pass the talking stick to Brother Al to see what his opinion is, or if he has any questions about it, because it is difficult. And like one of my clients said, when I had COVID and I was in this relationship, she's broken up with him now, with this abusive man, she said, Dr. B, it was a hot mess. And neither one of us were doing good for the other.
I'll take the talking stick. Thank you, Dr. B. Well, I'm pleased to add to the conversation our special guest today, and that's Dr. Phyllis Sharps, PhD, RN, Professor Emerita at Johns Hopkins University School of Nursing. Dr. Sharps was the L.C.M. Lawler Endowed Chair and Associate Dean for Community Programs and Initiatives, and Director of the Center for Community Innovations and Scholarships, which included 2 community lead nurse-led managed centers in East Baltimore, and also the Health and Wellness Program at Henderson Hopkins School, Henderson Hopkins Partnership School. She's published numerous articles on improving the reproductive health, on reducing violence among African American women, and her practice and research examine the consequences of intimate partner violence, that's referred to as IPV, particularly against pregnant and parenting women, specifically the effects of IPV on the physical and mental health of pregnant women, infants, and very young children. She's worked and been principal investigator in grants of $3.5 million for a 5-year research project on domestic violence, enhanced home visitation, which tested a public health nurse home visit intervention to reduce the effects of IPV among pregnant women and their newborns. She's also working on a grant that's called Perinatal Nurse Home Visitation Enhanced with Mental Health, which tests the use of computer tablets, for example, for screening and interviewing for IPV in the home. Dr. Sharps has received a 2-year, $1.2 million grant from the Health Services Resource Administration, HRSA, for Advanced Nurse Education Workforce, which provides scholarships to primary care nurse practitioner students preparing to work in underserved areas with underserved populations. She's published more than 120 articles, 1 book, and 10 book chapters. She's presented peer-reviewed papers at national and international conferences, and she's provided testimony before the U.S. Congress, including then Speaker of the House Nancy Pelosi, on the need to reform healthcare to provide better access to evidence-based nursing practice for pregnant women and new mothers. She's a fellow at the American Academy of Nursing and a 2013 inductee into the International Nurse Researcher Hall of Fame, Sigma Theta Tau International Nursing Honor Society. In 2015, she was honored by the University of Maryland School of Nursing Alumni Associations as a visionary pioneer. The Friends of the National Institute of Nursing Research awarded her the President's Award in recognition of her long-term commitment to leading interdisciplinary research teams. And she's taught graduate, turn the page, what a wonderful bio here, graduate doctoral nursing, medical, and public health students. And she's he's frequently a mentor to international visiting scholars and doctoral students. She received her BSN and PhD from the University of Maryland School of Nursing, a master's degree in maternal child health from University of Delaware School of Nursing, and she's completed a fellowship in adolescent health at the University of Maryland School of Medicine. Dr. Sharp has a joint faculty appointments at Johns Hopkins School of Medicine and the Johns Hopkins Bloomberg School of Public Health. She retired as a colonel from the U.S. Army Nurse Corps after 30 years of combined active and reserve duty. Well, Dr. Sharps, amazing. Thank you so much for being here. I'm looking forward to just you weighing in on any and all aspects of the conversation. And before I bring you on, I just want to say one note. We got a comment that I'm sure you'll cover in the course of your discussion from one of our regular viewers, Brother Mike V. He says, "Good afternoon, Baba. Can the panelists speak to you on domestic violence in same-gender relationships in regards to women?" So I think that's probably falling within the category of IPV. Dr. Phyllis Sharps, I'm going to pass the talking stick to you, and welcome to the conversation.
Yeah,
Thank
Phyllis.
you. I think I only had 10 minutes, so that was half of I told Oliver to edit it down, but I guess I should have done that for him. So let me talk to the one question about IPV in same gender relationships. And yes, it happens, and yes, it looks very much the same. I had experienced a couple of couples in the shelter. I was also a nurse in a domestic violence shelter. And as I was listening, you read about and you study about a lot of things, and the books say, yes, it's the same. But as this particular young woman was telling her story, and I'm listening, and all of a sudden she says, and it was like, oh, so it happens the same way, same kind of dynamics, power and control, using tactics of humiliation, sometimes mental type, psychological abuse. It can be physical abuse. Some of the challenges for men who are in a same gendered relationship and are experiencing is they may be reluctant to disclose what's going on with them because of the stigma and sometimes health providers are not as knowledgeable or understand that it could happen to men. So yes, and certainly as clinicians and those of us who are in helping professions should be alert to that. In addition, most of my work has been with women, and I certainly screen and ask women, but we should be asking the same questions to men, whether they are hurting partners or are they being hurt by a partner, and who is that partner. Over the years of my career, I've learned to use the word partner and ask, because you can't make an assumption that a female always has a male partner or a male always has a female partner. So I think, what's happening now is using gender neutral terms and asking people specifically about the kinds of relationships they are in and who their partners are. So when Oliver extended the invitation, he asked me to speak a little bit about COVID-19 and the impact on domestic violence. And I do believe the speaker before me also spoke a little bit about that, some of the dynamics that have occurred with that. And I would say, just as we know that alcohol and drugs do not cause men or women to be violent towards each other, it does influence behavior, and it lifts some of the prohibitions that might otherwise have prevented people to act out or use physical or other tactics. The COVID-19 virus did the same thing. So if people were not violent with each other before in an intimate relationship, they there may have been increased tensions, but a partner doesn't convert to that. But the stress of the COVID situation and the impact on living conditions, on work conditions, on health conditions may have already will push a stress relationship into and more physical activities. Early in the pandemic, we saw that some of the anecdotal evidence suggested that calls to help centers and shelters were decreased, and we surmised that it wasn't that there was less violence going on. It was that men and women or partners were in situations where the abused person may not have had private access to phones or felt like they couldn't call out, and so it probably was certainly still happening, but people didn't have the freedom and the privacy and to get to a phone to get to help. Certainly when women and men who are being abused have the option of getting outside of the home, then they are more likely to get to resources and maybe have an opportunity to call and reach out to help. And so certainly in our state, and I'm sure other states, put more available resources on websites and public places where individuals might be able to access them. But of course, that only reaches a certain segment of the population. If you don't have access to internet or some of those types of resources, you might not have been able to use those resources. I think one of the things that it did tell us is that it is very important to not only ask about the physical abuse or sexual abuse or psychological abuse, but also the safety of where people are living. Are they safe in homes? Are they afraid of someone in the home hurting them? And when we can do those things, those are an important part of the assessment. There was a recent article published in JAMA about one of the impact of the pandemic was this instability in housing. And I think one of the speakers referred to it before me, that people lost employment. If you're not working, you stand to lose your health insurance. If you had that, you're not being able to keep up with your home payments. And so in those kinds of situations, in those types of stressful situations, there was an increase in this report. Data showed that there was an increase in the instability of housing, and along with that, there was a significant increase in abuse. And you couple that with the fact that shelters were full, and where do people go to get some help or to get out of a violent situation? One of the things that was also highlighted, I think, more so, although it's been existing for a long time, is the crisis with Black maternal and child health in terms of birth outcomes. And we know, and there's compelling research that has linked pregnant women who are experiencing partner abuse with during the pregnancy, with poor pregnancy outcomes, up to and including loss of pregnancies, loss of infants, and indeed pregnancy-related deaths. High rates of those deaths are caused by intimate partner violence and/or homicide. Those are the short-term effects we've seen of the pandemic on pregnancy and reproductive health. And one of the things I think it also points out, and we can learn from other catastrophic situations, the Ebola virus, the devastating earthquake in Haiti, that when we have these types of catastrophic incidents that disrupt housing and employment, we also see an increase in violence against women, gender-based violence, particularly women, and then the adverse health consequences that are related. So I will stop at this point, and I think I should turn it back. I don't know if it goes to Al or Oliver, but I'm open to answer as many questions as I can.
Al, you're on mute.
Thank you. Thank you, Dr. Sharps. I was going to say you can pass the talking stick to any of us, and it's
Okay.
your choice. So I'm going to pass the talking stick over to Dr. Oliver, and let's continue the conversation. Dr. Oliver.
Yeah, well, I'm glad to see you, Phyllis.
You sent me the wrong link, by the way. It wasn't all me.
I'm not the producer, so I'm passing the buck.
But I'm here now, so yeah.
So one of the things that I wanted to say is that you mentioned the issue about pregnancy and about the effects on children. Could you give them the statistic? Because I think people will be surprised to hear the proportion of pregnant women where domestic violence occurs. So can you share that, Phyllis?
Well, numbers always depend on where you're looking, but we think the prevalence rate is somewhere on average between 3 and 10%. But in certain countries, in certain parts of the world, it can be as high as in the 20 to 30%. Certainly, third world countries and low income countries, the rates are a little bit higher, but the US as a domestic a high income country has a fairly high rate compared to other countries. And we know that the majority of children that are in homes where there's either domestic violence or their mother has been murdered by their male partner, many of those children either witnessed what was happening, were the first people to find the body, and more than 60% of those children never have any kind of mental health services. And so you can see, you can kind of just speculate what happens to those children as they grow up.
Yeah. And didn't Jackie's research suggest that it's, you said between 10 to 20%?
Mm-hmm.
And the other thing to say about Phyllis too is the fact that she does a lot of international work with Black women in the world, and a lot in the Caribbean now, as you talked about the issues associated with looking at domestic violence and how we see, Black women around the world and in Latin American countries as well. But yeah, the numbers are high, and when you present that information to men in groups, I think they're surprised because they tend to see an N of one, look at themselves that experience, but not realize the breadth of it. And I think battered women too sometimes see it within the environment that they live in and not recognize what goes outside of that. So, anyway, this issue of COVID that we talked about, I thought, Phyllis, that you brought out some really interesting points, and looking at the consequences. And I also thought it was very helpful what you said with regard to dealing with same-sex environments. And if you go to aadpp.org, and you'll see a number of cities there. Look at Memphis. And in Memphis, we have a brother who's talking about his experiences associated with domestic violence in his relationship. There's some other cities that do it as well. But the brother was very explicit in terms of talking about his situation and what he had to go through associated with it. But Boston and Tacoma and Detroit are other cities that are part of the African American Domestic Peace Project, and they have conversations about domestic violence and same-sex relationships too. So, anyway, thanks, Phyllis, for your insight and sharing your ideas and your knowledge associated with the issue. And with that, I'm going to pass this talking stick to Dr.
Can I just say one thing too? We didn't, and the caller didn't ask this, but the rates are even higher for transgender individuals as they transition or move from one. So we need to be aware of that. And I would point out that the lower numbers that I gave were for the population in general. But if we certainly look at African American women or women that or Black women, I've had to get used to. I don't like saying Black women because to me it doesn't say anything about your ethnicity. But I also have come to learn that women from the Caribbean do not necessarily see themselves as African heritage, and so Black encompasses all of that. But if we look at Black women and we look at our Native American sisters, we have the highest rates of domestic violence and the worst birth outcomes for a variety of reasons. And so the numbers, when you look at that overall average population number, may look low, but if you start looking at individual ethnic, racial groups and cultural groups, you'll see that generally women that have lots of pigment in their skin, like me, we have very high rates and very poor birth outcomes.
That's right.
So we've had a time talking about the problem. We know that domestic abuse and intimate partner violence, that they take many forms, from the verbal to the nonverbal, to the use of body size and resources, and the abuses in multiple ways. And when we couple that with considering COVID, catching the disease or having impact of things like long COVID that have lasting effects on your literally on your organs, then I guess the next question we need to ask ourselves is, what can we do about that? Because we know the problem is real. We've studied it. It's validated. What suggestions, Dr. Sharp, in your work, do you see that we could use and apply in our community today in addressing the intersection of violence, COVID, racial identity, and the outcomes that we have for our health? I know this is a big question.
I think a lot of what we need to do is myth busting and education, because we have so many things that folks believe on that might have a kernel of truth, but most of it is not truthful, and it stands in the way of us getting the help and taking advantages of the resources that we need. It was eye-opening to me. I was a part of a think tank early on with the National Black Nurses, and there was a big concern about the number of Black nurses who were not getting the immunization. And to me, that was a no-brainer. And all of, we put a lot of stuff out about it, that it was experimental. Well, you know what? Most of the drugs and most of the things that we so readily take advantage are experimental.
Mm-hmm.
So, but I think getting knowledge out, attacking some of the stigma and the misbeliefs that people have. Yes, as Black people, we have been exploited and been experimented on, but a lot of that are being spoken by people who are not around, who don't know the history of any of that, and yet they keep, promoting it through. And we need to call upon the people that speak truth and that communities will believe. So sometimes our clergy are at fault. Sometimes our community leaders may not be getting the story quite right. So I think that that's one thing. I think that certainly as we train and educate professionals across the whole healthcare, not only nurses and doctors, but social workers, psychologists, teachers, all of those people, we need to make sure that they understand some of the dynamics, what they might be seeing, for instance, in children. We know that people are not born with a violence gene. They learn how to do that. And if you learn how to do it, you could unlearn or you could substitute other behaviors. So that we need to, help people. Whenever you have two people together, the chances of conflict arising is 100% at some point. So how do we solve issues and teach people how to work around those issues without always resulting to physical or emotional abuse of individuals? And I know I'm going to be, but I do think we have a problem with guns in this country. We know that when there's a gun in the house and there's violence, the woman generally the odds are against her getting out of that very safely in severe cases. And so, what is it that we in America feel like we have to arm ourselves against, fighting against our own population? So I think that's that. I certainly, and you've heard about, I've tested a nurse home visitation where we go into homes and talk to families and mothers about how to be safe. We're not advocating that they leave relationships, but eventually many women do. But at least, how can you be safe? How can you protect your family? Helping people understand that your children see and hear everything. We have data that shows even the youngest infant is impacted by being in an environment around that. So there have been promising programs where, maybe you as a couple will never be the way you are, or, loving, but you are parents. And how can you be parents for your children and manage that part of your relationship, but without exposing them to the violence? I think there's lots of training we need to do with our responders, police, those kinds of people, so that they understand and can read and not resort. There are techniques that escalate violence, even if you're trying to help. And how do you use those techniques? I learned a lot about that working in shelters. And what I've learned is that women have very short fuses when they have been in violent relationships. So how I talk to those women is probably very different than the way I talk to women that I'm in the hospital providing nursing care. So a lot of education, I think, a lot of preparing our communities to be able to work with their constituents and get the truth out about what's happening and what they can do and what's available.
Let me jump in, Dr. Sharp, and ask about what role holding perpetrators accountable plays in both prevention and in healing. And is there a strategy, is there language, systems to, again, increase accountability for those who are violating the dignity and humanity of their partners in IPV? What do you think?
So I would hear a lot in the shelter that women wanted the violence to stop. They didn't want to call anybody because they didn't want to get him in trouble. And that we hear a lot of. And so talking to them about understanding that people are responsible for their own behavior. And you know, you're not responsible for his behavior or how he reacts to you. But very often a message was heard when we talked about the children that are involved and how that. But you can understand because, you know, we know our Black men, when they get in contact with police, it often is not a good outcome. So certainly I understand that, but there are training needs there, I believe. And in places, for a while in Baltimore, we had domestic violence police units that responded and had different kind of training. But I think we need, you know, when people talk about community policing and or defunding police, I think what they really are trying to say is maybe we need to appropriate funding in a different way and different training, and maybe police should not be responding to every crisis. Maybe there's a different set of people that need to go to a domestic crisis or a substance use crisis, or, you know, that kind of thing, that have skills in terms of assessment, diagnoses, de-escalating situations, and may not have guns also. So I think that that's important. I greatly admire the work that Oliver is doing, and I think we have to also have more men, because, you know, I never have worked with men, because I think that men that are perpetrating violence probably don't want to hear from me as a woman about what they should be doing. And so we need to have more, I think, men that are involved in working with men that think and understand the way men and how we, and, you know, we socialize our men differently than we do women. And
we have to come back to do more on this. We're out of time. This is a wonderful conversation. We can go on. I've got a million more questions for you. So it means, Dr. Sharps, you got to come back. And let's go.
Well, now that I know how to do it.
Yeah. Well, I wanted, before we close, Dr. B, to talk about the after the show event, because we've got ways to, we're building on this community of healing. Dr. B, got about a minute.
You're on mute.
Thank you so much. I know we only have a few minutes and 1 minute. And I want to say thank you again, Dr. Sharps, for joining us. After this show, we have one that is called the Recovery Room. So we continue to have this discussion. Now, at the next part of our program, we will have a Zoom link that you can get. Hopefully it'll be shown on the show or in our site on a moment. But what we like to do is invite people to join us. And what we will do is have like a town hall healing circle where people will talk about domestic violence in their own lives or in their experiences. And we will also give people an opportunity to join us in the healing procedures and that are African centered. And we have this every month, the last Friday of the month. And we'll always do this for the rest of the year and into next year. So we ask you to join us as we come back to the healing circle, looking at the disproportionate impact of COVID and long COVID on the lives of African American people. And once again, thank you.
Can we put the link to the next part on the scroll so people can know how to join the Zoom? Again, thank you all for being here. Thank you for listening. What a great conversation, Dr. Sharps, Dr. Williams, and of course, Dr. B. Thank you all so much. And let me see, is there another way that we can connect so that people know how to get to the program following this one? Can they call your phone number, Dr. B?
Yes, they can. At 612-839-1449. Again, 612-839-1449. We're going to be rolling into that in just a few minutes. And
All right.
anyone who can join, you actually get to ask questions and talk about it. So
There you
join us at that time. And again, Dr. Sharp, if you want to come on and hang with us a little bit longer, we got plenty to hear from you. So thank you, everybody, for doing it, and Brother Al for hosting us today.
And we'll
Thanks,
see you
Phyllis.
next time.